Hello, my name is Samantha Rape, and I will be talking to you today about recurrent exertional rhabdomyolysis. The objectives today will be about what is RER, the clinical signs. We'll talk about the diagnosis of RER and how common it is in certain breeds of horses, the treatments that can be taken, management nutritionally and training, research, and the conclusion. Exertional rhabdomyolysis is also called tying up, which is a group of diseases that cause muscle damage and pain during and immediately following exercise. There are two types and forms of tying up: polysaccharide storage myopathy, also known as PSSM, which most commonly affects quarter horses, draft breeds, and warm bloods. And recurrent exertional rhabdomyolysis, which I'll be talking about today, is RER, which most commonly affects thoroughbreds as well as standard breeds and possibly Arabians. Horses suffering from RER are unable to properly regulate the calcium ions that control normal muscle contraction and relaxation. It appears to be an abnormality in how the cells regulate calcium, resulting in excess levels of calcium being excreted from the cell body. This causes contractions and muscle spasms. When a horse has an episode of RER, the gluteal muscles will tie up or become hard, and the horse becomes stiff, and movement sometimes becomes very painful. Horses often refuse to walk and will sweat profusely after exercise and an episode of RER. A similar abnormality called malignant hypothermia is common in humans and pigs. The exact cause of RER is still unclear, but still it's going under some investigation. But what is understood thus far is that dietary deficiency, exercise, high-grain diets, and/or excitement triggers the problem. And we'll talk about some experiments that try and figure out, like with diets and stuff, and genetic inheritance. And also genetic studies, including preliminary breeding trials, suggest that RER is an inherited condition in thoroughbreds as well. This mechanism of action is based on the observation that intercostal muscle biopsies from RER horses readily develop contractures when exposed to agents such as halothane and caffeine that increases muscular calcium release. So every time a muscle contracts, calcium is released from the muscle storage sites and then taken back up into storage sites for muscle relaxation, as you can see in this picture. The altered contraction and relaxation of muscle suggests that abnormal intracellular calcium regulation is the cause of this form of RER. These intramuscular calcium concentrations are extremely small compared to the amount of calcium in the rest of the body, such as in the bone, and are completely independent of dietary calcium concentrations. So the clinical signs of RER, well, they're varied depending on the severity of the episode. In mild cases, affected horses will be somewhat stiff after an exercise. At the other end of the spectrum, the intense pain associated with severe and generalized RER might incapacitate a horse to the point that it might be unable to bear weight and lay down, become lame. During exercise, affected horses develop a short, stiff stride. These signs can worsen if exercise continues, and upon stopping, horses often are very reluctant to move and might adopt an unusual stance. Sometimes males frequently posture as if to urinate. The muscles of the hindquarters usually are the most severely affected. These areas will be firm and sometimes painful, and cramping is evident when these muscles are palpated. Other signs that the horse is painful include profuse sweating and persistently elevated heart rate and respiratory rate. The pain persists for several hours after the onset of an RER episode. So, diagnosis. Well, it's best made based on several observations, such as the history of the horse, if there's repeated episodes of RER or tying up in some horses that are on well-balanced diets and reasonable training regimens. Sometimes if blood protein measurements such as creatine kinase activity with exercise, it will increase in the presence of centrally located nuclei in the muscle biopsies without evidence of abnormal polysaccharide. Like myoglobin, these proteins are contained within the muscle cells and they are released into circulation when cells are damaged. So blood activity of CK, a specific indicator of muscle damage, will increase rapidly and peak values occurring probably about 4 to 6 hours after an episode of tying up. Compared to creatine kinase, activities of aspartate AST basically increase and decrease more slowly than creatine kinase. AST might remain elevated for 7 to 10 days after an episode of RER. As you can see from these pictures, the cells from the affected horse have nuclei seen as black dots located towards the center of the mature muscle fibers rather than underneath the cell membrane as they are in the healthy muscle horses. Like I said earlier, RER is a common cause of chronic tying up in thoroughbreds, standard breeds, and Arabian horses. A study of racing thoroughbreds indicated that about 5% of horses develop RER during a racing season. Researchers have shown that RER is more prevalent in females than males and more common in nervous horses than calm horses. Therefore, RER is shown to be more prevalent in mares with up to 80% of 2-year-old fillies being affected. Nervous temperaments will increase prevalence by about 5-fold, and a horse with an underlying lameness is 4 times as likely to suffer from RER. At the University of Minnesota Equine Center, they performed a study of around 1,000 horses at Canterbury Park during the 1995 racing season and discovered that about 5% of thoroughbreds tied up that season. 33% of trainers had a horse with tying up in training. The distribution was no more than 3 tying up horses per trainer. 15% of the 2 and 3-year-olds that tied up were unable to race that season. So no difference in race performance between tying up horses that raced versus matched controlled horses were ever seen. So treatment. Diet manipulation is becoming the method of choice in controlling RER, particularly in the equine athletes that are closely monitored for pharmacological substances. Well, a well-designed exercise program and nutritionally balanced diet with appropriate caloric intake and adequate vitamins and minerals are the core elements of treating RER. The objective is to relieve anxiety and the muscle pain within the horse that's being treated and within the infected animal. Oral and or intravenous fluids therapies can be used in horses that seem to be dehydrated and can be given a non-steroidal anti-inflammatory drug. Sometimes acepromazine is very helpful in relieving the anxiety, and it may increase the blood flow within the muscles. Also, you have to remember that rest and hand walking once the initial stiffness has decreased is a prime importance. At this time, the diet should be changed to a good quality hay and little grain supplement. Horses that suffer from RER are benefited from returning to exercise as soon as possible and continue their normal routine schedule. However, horses that seem to be more extreme and have more damage to their muscle from overexertion should rest longer and gradually return to a similar routine schedule as it's used to. So nutritionally, how can you manage this? As with many horses, feeding a forage at a rate of 1.5 to 2% of body weight is a fundamental part of the diet. So horses with RER seem to benefit from fat supplementation only when they require high caloric intakes. Once caloric needs are met, a diet should be designed with an appropriate amount of fat and starch. One way to lower serum creatine kinase after exercise when a high caloric intake is required is to feed a low starch, sometimes a high fat ration diet. For RER horses, the recommendation is to feed no greater than 20% of diet in digestible energy as non-structural carbohydrate, and to supply 20 to 25% of daily digestible energy from fat. The diet should contain no more than 5 pounds of sweet feed, around about 600 milliliters of vegetable oil, and 5 pounds of rice bran per day. Studies have shown that replacing traditional grain-based diets with Relievy resulted in significant importance in horses with RER and PSSM. This diet is set for a 500 kilogram to 1,100 pound thoroughbred in hard work. Note that the cereal grains are providing less than 20% of this horse's daily digestible energy requirement, and that vegetable oils and high-fat feeds like rice bran are supplying about 24% of a horse's daily digestible requirement. So Relievy, what is it? Well, it's a formulated type of feed that is for any health condition in which a low starch diet is recommended. Specifically, a low starch diet may be beneficial for horses prone to the RER, PSSM, and then these metabolic problems may be triggered or by consumption of soluble carbohydrates found in diets that contain typical carbohydrates. Relievy is fully fortified to provide the appropriate levels of vitamins, minerals, and for optimal performance. It utilizes natural sources of vitamin E, which is a powerful antioxidant more bioavailable than synthetic sources, to ensure horses receive the maximum benefit. So as you can see in these pictures right here, replacing a traditional grain ration with Relievy and providing regular daily turnout and exercise and key components in the prevention of PSSM and RER, as well as the management of specific diseases. So as you can see, Relievy, it's more fiber than it is in starch, as in sweet feed normally is. So you want to try and decrease the high carbohydrate and replace it with a high fiber. As Stephanie Valberg said, relieving has been of tremendous benefit to thoroughbreds, quarter horses, and warm bloods that suffer from tying up. Our studies found that relieving provided the best relief from muscle stiffness and soreness when combined with regular daily activities. And as you can see in these pictures, Relievy, the creatine kinase, fed to a regular horse, or the grain mix is the same, the high starch diet, as compared to the Relievy, the creatine kinase after exercise has lowered. Also, the traditional performance in the second graph, the diet is the effect of diet on the creatine kinase in horses with equine polysaccharide storage myopathy, which is PSSM. Affected horses fed Relievy showed the least muscle stiffness. So this can try and prevent any kind of stiffness after exercise, as if you would feed a horse with the strict high carbohydrate diet. So training. In thoroughbreds with RER, keeping a tight hold during warm-up on early stages of such as canter or gallop work, it can be very counterproductive by increasing the level of excitement. However, in standard breed horses, more than 15 minutes of jogging at a time should be avoided because this form of exercise is most detrimental. Then on the other side, dressage horses should be exercised with intervals of collection and opportunities to stretch in between each exercise. As mentioned before, overexertion is a risk factor for tying up. Increases in the duration of intensity of training, sessions should be gradually increased, and the horse should not be exercised to its fatigue. Stall confinement should be kept to less than 24 hours if possible. Since RER appears to be a stress-related disorder, management strategies to reduce stress and excitability in these horses are very important. These include turning out, exercising, or feeding these horses before other horses, providing compatible equine company, and the careful use of low-dosage tranquilizers during training. Dantrolene can be given 1 hour before exercises to horses that are not fed their morning feed and is effective in preventing RER. However, little absorption of dantrolene occurs in horses that have been on full feed at the time of administration. Dantrolene is used to prevent malignant hypothermia in humans, and swine by decreasing the release of calcium from the calcium release channels. Also, another drug that can be used is phenolphthalein, which has been used as a treatment for horses with RER also. It acts on a number of ion channels within muscle and nerves, including sodium and calcium channels. Unfortunately, a long-term treatment with these two drugs is very expensive. So prevention of further episodes of RER in horses that are acceptable to it should include standardized daily routines and an environment that minimizes their stress. So Mickelson et al. At the University of Minnesota and his group wanted to use this test to determine how RER is inherited. So horses of non-RER status, most of which were diagnosed with the muscle contractor test, were mated to produce 23 foals. An RER stallion, the son of an RER positive mare, and a healthy stallion were bred to 5 healthy mares to produce the 23 foals. Of these, 5 of 12 colts tested positive for RER. So did 4 of the 11 fillies. Using simple segregation analysis, Mickelson's group determined whether it affected offspring segregation or divided into expected proportions for each pairing. With autosomal dominant traits, if one parent is affected, that parent carries one copy of the affected gene, and there's a 50% chance of producing an infected offspring. If both parents are infected, both parents carry one copy of the infected gene, and there is a 75% chance of producing an infected offspring. So in this study, Mickelson tried to prove that this is an actual autosomal dominant trait where only one parent actually needs it to pass it on to its offspring. So Stephanie Valberg et al., she did a research where RER in thoroughbred racing can affect the diet and exercise intensity. And her associates, they wanted to see if in thoroughbred racehorses, if high carbohydrate diets and exercise intensity is associated with the RER. So 8 thoroughbred horses were used, 3 with RER and 5 healthy. They were fed 3 different diets. They were fed a low carbohydrate diet, a high carbohydrate diet, and also a fat diet. And all horses were trained and placed on a treadmill 5 days a week, 2 days at a gallop, 2 days at a canter, and 1 day at a trot. And note that none of these were consecutive, so back-to-back days you didn't do 2 canters, but you might do 1 canter, 1 trot, and then another canter. But after each exercise, blood was collected from them after they were finished to analyze for plasma lactate concentrations and creatine kinase activities. The results showed that there wasn't an effect of diet or daily exercise in the control group of healthy horses. However, the horses with RER fed a high carbohydrate diet showed high levels of creatine kinase activity. So Dr. Valberg concluded that management of horses with RER should be treated with diets that are low in carbohydrate and include a routine exercise protocol that meets but does not exceed its daily caloric work. So the key points I want y'all to take home from this. So a well-balanced diet containing the right amount of energy from fiber and starch and oils with all requirements for vitamins and minerals being met is only part of the puzzle for effectively managing both PSSM and RER forms of tying up. Horses that suffer with tying up need to undergo a regular exercise program, and care must be taken to ensure horses are allowed to gradually build up their fitness, and horses should never be exerted beyond their level of fitness. Prolonged periods of stall confinement or rest should be avoided, and horses that have tied up before are better off housed in larger pastures or yards so they can move around freely and with other horses also. Rest days need to be managed very carefully. While these horses certainly do need some time to be horses, they should never be fully boxed rest, but instead should be walked or turned out to pasture for voluntary exercise on these days. Nervous horses that are prone to RER should be managed to keep their stress at a low level, also housing them with a buddy, allowing them plenty of turnout time, feeding them first, and maintaining as regular a schedule as possible are a few things that might help a horse, maybe to prevent it and also treat it. Well, and these are my resources, and I hope y'all learned something today. If y'all have any questions, feel free to contact me.